Next on the agenda and scheduled for hearing is Senate Bill number 55 by President Ruggerio, an act relating to health and safety, Hospital Workplace Violence Protection Act. President Ruggerio, welcome to the committee.
Thank you very much, Madam Chair and members of the committee. This legislation is about protecting frontline healthcare workers. Over the past year, we've seen them put themselves in harm's way and make countless sacrifices to care for our loved ones. But beyond the pandemic, there's another threat that has increasingly plagued nurses and bedside caregivers. And I'm talking about workplace violence. And on any given day, healthcare professionals know they could easily be violently assaulted or threatened. No one should be afraid to go to work, especially when they're doing work, God's work, as we've seen what they've been doing with the coronavirus. This legislation is long overdue and very simply establish a common sense protocol that provides for training, reporting, record retention, and planning around workplace violence. Far too many of these cases go ignored and undocumented. It is the responsibility of every healthcare facility and the responsibility of all of us to do everything possible to keep healthcare workers safe. This bill is an important step in that direction, and I will ask for your support. And Madam Chair, I will be willing to entertain any questions any of the committee members may have.
Thank you, Mr. President. Do any of the committee members have any questions or for President Ruggerio? I don't see any. I don't see any raised hands. Thank you, President. We appreciate that, and we do have some people calling in. Some witnesses at this time that the clerk will call. Thank you very much, President.
Madam Chair, may I interject for a moment?
Yes, Senator Archambault.
Yes, please. May I be counted as president? I had a problem with my audio, and thanks to Senator Hoyer, she said log out, log back in. I did that. Now I can hear everything. Thank you. Thank you, Dawn.
Thank you very much, Senator.
Thank you.
And thank you again, Mr. President.
Thank you very much, Madam Chair, members of the committee.
And do we have the first witness? I don't see any. Is that Lynn Blais? Very good. Our first witness this afternoon on Senate Bill number 55 should be Ms. Lynn Blaze of the United Nurses and Allied Professionals. Can you hear me?
Good afternoon.
Yeah, thank you. Welcome to the committee.
Thank you, thank you. So good afternoon. My name is Lynn Blaze. I'm a registered nurse for over 35 years. Currently as a recovery nurse at Our Lady of Fatima Hospital, as well as the president of the United Nurses and Allied Professionals. Thank you for allowing me to testify in support of this very important bill. I also want to thank the Senate President Ruggerio for his work on behalf of all of our members and all bedside caregivers. All our hospitals have policies on paper about how to address workplace violence. But with so many of the instances going undocumented, it's difficult to understand just how bad it's gotten for far too many frontline healthcare workers. This legislation provides critical accountability and transparency. It establishes needed protocols for training and retention of records. This is a much-needed measure to keep frontline healthcare workers safe. We have come before you in the past to ask for your help to create legislation to protect patients and those charged to care for them. In 2006, you passed a Safe Patient Handling Act, which set forth rules and regulations on the movement of patients. And due to that legislation, we have had a marked reduction in staff and patient injuries. In 2008, you passed legislation prohibiting mandatory overtime, which forced hospitals to schedule appropriately and stop risking patient safety by locking in exhausted healthcare workers. I'm happy to report that this legislation has worked, and the staff no longer have to worry about being mandated into unsafe extended shifts, which has helped to improve patient outcomes and staff satisfaction. But today, we are in desperate need of your help to pass legislation that will protect the health and safety of every hospital professional. No one, as the Senate President said, should go to work, should be afraid to go to work. But sadly, far too many are. Within the last 3 years, UNAP has surveyed our members working in hospitals, asking about their experiences with workplace violence. Here are just some of the responses I hope you will keep in mind when considering this legislation. 42% of those that responded said that their unit had experienced a violent or near-miss violent episode requiring intervention by local police. 67.8% said they had personally experienced workplace violence on the job. 63.7% said that they have at times felt unsafe working in their unit. What has been created in this bill will be the teeth that we so desperately need. It will create a working safety committee. It will create and implement assault prevention and protection programs, require safety training, and if this bill passes, all instances of reported workplace violence will be documented with outcomes tracked. This data will be critical in staffing decisions. This legislation will start to change the culture that being on the receiving end of workplace violence is just part of the job. No one should go into work thinking it's okay to be yelled at, hit, spit at, grabbed, kicked, or punched. Just some examples over the last few years at Fatima Hospital alone have been, we had an employee that was admitted into the ICU with a severe head injury after being jumped by a patient. We've had another that required leg surgery after being assaulted by a patient. We had a pregnant staff member that was punched and kicked by a patient. We've had many staff who have been bit at, spit at, and verbally assaulted. The verbal assaults are endless at times, and those are just a few examples of what the staff has had to encounter. So thank you for your thoughtful attention and for the opportunity to be heard. Respectfully, I ask that you support this legislation so that in the very near future I can return to you and tell you that because you passed the Workplace Violence Protection Act in 2021, staff injuries have been reduced and hospitals are a much safer place to go to work. Thank you for your time.
Well, thank you very much for your testimony, Ms. Blais. We really appreciate it. Do any committee members have any questions or comments for the witness? I don't see any at this time.
Chair?
Do we have any?
Madam Chair?
Yes, Senator.
First and foremost, thanks to Senator Lombardi, he reminded me to be encountered the affirmative on the two advice and consent matters, and then if I may also be in the affirmative on 14, Senate 14. And then I do have a question for the witness.
Yes, very good. Well, if the clerk will record Senator Archambault's votes, please. Thank you, Senator.
Thank you. If I may ask my question?
Yes, please.
Okay, thanks. Maybe I'm coming into this a little dry, but it's a great piece of legislation in terms of documenting workplace violence. I had a chance to take a look at it. Clearly, if there's an assault or something that happens, my inference would be that there's going to be a call made to a police department for an arrest if necessary. And so my question then would be, could you explain what would you endeavor to explain what the process is now and what the weakness is in the process that brings you to pass this legislation, ask for this legislation? Ms.
Blais, are you still there?
I think what we have seen through the years is a climate inside the hospitals that they prefer that you not contact the police departments, that it keep it inside our walls, don't air our dirty laundry, that an assault happened, that people were injured. Even the documentation internally in an organization is spotty at times, difficult to track when it comes to knowing where the assaults are happening, how they're happening, and then what the outcomes are from those assaults. Do we have units that are more dangerous than other units? Is it because we don't have adequate security on certain units? So this legislation will provide the ability to be able to track those things, put staffing mechanisms into place so that you add the appropriate staff to take care of the patients. And then to take care of the employees on those patients that would have the tendency to potentially act out.
All right, thank you, Madam Chair. May I just follow up?
Yes, please, Senator.
Yeah, thank you. I asked that question really in the law as attorneys. We generally don't ask questions we don't know the answers to. And I actually had a client who was assaulted while at a hospital. I won't tell you which one, but it was a couple of years ago. He was assaulted by a couple of security guards at the hospital. And I opened a formal inquiry in the hospital, and that was a process in and of itself. It took some effort, a couple of letters, just to get the higher officials in the hospital to even look at the matter. And then it seemed to be an apprehension to accepting responsibility. So I experienced that firsthand trying to help someone who was, and I mean, this guy was really assaulted. He had significant injuries from security at the hospital. So it would have been great had everything been really properly documented and there was an attitude towards cooperating. So this legislation really seems to address that. Thank you.
Thank you, Senator Archambault. We appreciate your testimony, Ms. Blais. Thank you for answering the questions. And I think, did you have anything else you'd like to add?
Nope, I just want to thank you for your time.
Well, thank you very much. We appreciate it. And now we'll go on to our next witness. We should have Miss Patricia Creaner on the line. Are you there?
Yes, I'm here.
Good afternoon and welcome to the committee. You may proceed with your testimony.
Okay, thank you. Thank you, Chairwoman Coyne, President Ruggerio, and members of the committee for the opportunity to speak to you today. My name is Patricia Creaner. I am an RN. I currently work at Kent Hospital in the intensive care unit. My over 27 years as a health professional, I've experienced many, many instances of violence in the workplace, but I will only share 2 moments with you today. Several years ago, I was back to work following a brain aneurysm repair. I remember this vividly because I was very careful to avoid injury. I was in charge of a med-surg unit one night. Now, for the well-being of the patient, we frequently allowed family involvement in the patient's care. One such patient had a particularly attentive husband. Early in the evening, he told me he was leaving to run errands and would be back in a few hours. I assured him his wife would be properly attended to while he was gone. Later that night, there was a loud exchange in one of the rooms, and 2 nursing assistants came running out to the desk exclaiming that the husband of this patient was infuriated when he returned to find that his wife had been incontinent while he was gone. They reported he began throwing objects about the room and screaming expletives, demanding to see the charge nurse. I walked down towards the room, and before I could walk in, the husband rushed out and grabbed me. While firmly holding me with his left hand, his right fist was directly in front of my face. He was saying how much he wanted to punch me right now, as well as other loud insults. His fist was moving back and forth, making a motion as to hit me. He was quite strong, and I was completely petrified of a blow to the face or the head. I could see the secretary in my left periphery, and there was a CNA in my right. I was afraid to move, but I just said, "Did you call?" The CNA said, "Yes, security is on their way." After what seemed like an hour, security officers arrived, and under my advice, he was escorted off the premises. I spoke with the nursing supervisor as well as a manager directly after this incident, and they both assured me that the proper charges would be filed. I was also told that security would file a charge as well. The next day, I expected to receive a call instructing me to go in and give a statement. None ever came. To make a long story short, when I arrived to work that day, the manager took me aside and told me the hospital decided not to press charges because of his circumstances. To add insult to injury, he was allowed back into the hospital. I was very scared that day, not just for what he might have done to me, but for my fellow coworkers. I was also nervous about working on the unit, knowing he was going to be there. The second incident happened not very long ago. We were treating an uncooperative patient with a history of substance abuse, And based on her symptoms, my experience led me to believe she was likely beginning withdrawal. While administering treatment to the patient became aggressive and combative. She grabbed my hair. I believe I had a ponytail. And during the struggle to get free, thankfully another co-worker heard the commotion and called a code gray. This summoned security as well as a house officer who was a physician assistant. With the help of security, the staff and myself were able to get the patient into the bed. Although the patient seemed to be escalating again, the house officer was very reluctant to provide any medications to aid withdrawal. The patient again became unruly, and a code gray was called immediately again. Code gray is called anytime a patient gets physically combative. On that day, I was wearing a necklace, and it had a flower with 5 or 6 points. The patient saw it, and she perceived it as a Star of David. She began calling the anti-Semitic hate slurs. She said she was going to make sure I died. I asked the house doctor again for some type of sedative for the patient, but she refused. I told her, if we don't, we will likely be calling another code gray. This occurred towards the end of the PA's shift, and she responded by saying that she'd be off by the time that happened. She was aware of what happened to me. She knew how and why I was attacked. She only relented she only relented a time after and gave the patient a sedative when she indicated that she didn't want to inconvenience the doctor who was about to begin the next shift. You know, these events happen consistently. Nurses and other bedside caregivers are expected to endure the worst kind of abuse and assault. But we shouldn't have to take it. And this is why we need your help. President Ruggerio's bill mandates that safety policies be enacted to record and track these instances so that healthcare workers can have the support they need to feel safe on the job. I thank you very much for listening, and I respectfully ask that you support this bill.
Well, Ms. Creaner, thank you so much for calling in and for your testimony. Do any of the committee members have any questions of Ms. Creaner at this time? Okay, I do not see any hands raised. Thank you very much for your testimony. We appreciate it.
Okay, you're welcome, and thank you again.
Of course. Next up, our next witness is Mr. Frank Sims from the United Nurses and Allied Professionals. Mr. Sims, are you there? I think we may have lost him. Mr. Sims? We'll try that again. Mr. Sims?
Yes, ma'am.
Good afternoon and welcome to the committee. You may
Thank
proceed
you for having me.
You may proceed with your testimony, sir.
All right. Good afternoon. My name is Frank Sims. I'm an emergency room nurse and the president of UNAP Local 5098 at Rhode Island and Hasbro Children's Hospital. I've been a nurse for 10 years, and I've experienced and witnessed some intense and traumatizing moments of workplace violence. I can give you my personal accounts as examples. I was in Trauma Alley in an emergency room where our trauma rooms are, and one of my fellow nurses was being assaulted by a patient, and security was down the hall. I was the closest one in proximity. By the time I arrived at the scene, the nurse was in the headlock and being struck in the face. I tried to intervene between the two in the situation, at which time I was assaulted. And we were both put out of work for injury, me due to my neck injury. I have seen another nurse came to get me one day because the nurse was put into a corner and had her genitalia grasped and was generally being assaulted by a patient. I took her to the director of the department. She said she would take care of it. When I circled back with the nurse, I learned that no phone calls to the authorities had been made, and no follow-up with this nurse whatsoever. Being in the emergency room, this is not something that I'm unfamiliar with. I've been struck, I've been kicked, I've been bitten, I've had urine thrown on me, I've had my life threatened multiple times. This becomes something that sometimes feels like it just is part of your job, and it shouldn't be. Nurses and other bedside caregivers are just used to taking it. Sometimes it does feel like it's just part of the job, but it shouldn't be, and it doesn't have to be. That's why we need your help. I'm grateful to the Senate President and all the sponsors for recognizing this escalating problem must be addressed. The legislation provides protection for caregivers by requiring safety training and preventative measures be adopted by the hospital to keep us more safe. So many of these violent instances go undocumented. This bill will help change that. Thank you for your thoughtful consideration. Please support so that no healthcare professional be afraid to go to work.
Thank you very much for your testimony, Mr. Sims. I'm so sorry to hear about this workplace violence, and thank you for all you do. Do any of the committee members have any questions of Mr. Sims at this time? Seeing none, Mr. Sims, thank you very much for your testimony. With that, we've also received several letters of support of Senate Bill 55. And at this time, may I have a motion to hold for further study on Senate Bill 55?
So moved.
That was moved by Senator Archambault. May I have a second, please? Oh, I'm sorry, it was moved by Senator Frank Lombardi. May I have a second?
Doesn't matter, I can second it. Senator Archibald can move it, I'll second it.
Seconded by Senator Lombardi. At this time, will the clerk take a roll call vote, please?
Senator Archambault.
Aye.
Senator Burke.
Yes.
Senator Oyer.
Aye.
Senator Lombardi.
Yes.
Madam Chair.
Yes.
President Ruggerio. It's 5 in the affirmative, none in the negative.
The vote was 5-0, and the bill will be held for further study. If I could just take a moment, as a matter of housekeeping, I would like the record to be clear. As you may see in our attendance, there's no minority member present. So we have made every effort to reach out to the minority member, and we contacted the minority office to inquire about the member attendance. And we have not received a direction to delay the meeting, and our quorum requirements were satisfied before commencing the meeting. Just for the record, please.